The light of life is a gift which every living being deserves to experience, and we consider it a privilege to spread a part of this light among mankind. We are Sun Hospital, an institution with a rich medical heritage and a strong presence in Kerala's healthcare industry. It was during the early 1980s that Thrissur Heart Foundation, under the chairmanship of Dr. P.M. Verkey, decided to initiate a venture of international standards committed to provide excellence in treatment, nursing care service, and cleanliness. The project took off on 7th February 1986 with the divine grace of His Holiness Pope John Paul laying the foundation stone. The year 1992 witnessed Sun Hospital, a fully fledged multi-super specialty hospital, being dedicated to the nation by His Excellency Shankar Dayal Sharma, former President of India.
I had an idea to make a hospital ideal for our country. A hospital with quality control equivalent to the international institutions. I am happy Thrissur has a wonderful hospital and nationally accredited, internationally accredited hospital where you can safely step in and your treatment.
Sun Hospital is located at the scenic locale of Thrissur, also known as the cultural capital of Kerala.
Sun Medical and Research Center is the first and the only hospital in Thrissur district which has been accredited by the National Accreditation Board for Hospitals and Healthcare Providers. We started our work in 2009 and we achieved our goal in 2011. This achievement is a direct result of the dedication and sincere effort of our staff, doctors, management and directors to give quality healthcare services to our guests and to our patients. We make sure to set new quality benchmarks through constant training and the feedbacks we get from our patients.
The institution boasts of world-class surgical units and is credited for being the first NABH accredited hospital in Thrissur and the first in Kerala's private sector to conduct angioplasty and bypass surgery.
We do almost all adult cardiac cases and all the CABG cases are done on beating. Now we have switched over to minimally invasive cardiac surgery, where we can perform all these surgeries with a very small incision so that the patient can go home even as early as the third postoperative day.
We are geared to perform all kind of microneurosurgical procedures, and we do microvascular surgery involving cerebral aneurysms, cerebral AV malformations. We have intracranial bypass procedures and also carotid endarterectomy. Our center also does extensive microsurgical procedures for brain tumors and skull-base surgery. We do neuroendoscopic procedures and also endonasal extended skull-base surgical procedures.
Our hospital has been the pioneers of interventional cardiology in Thrissur. We have been doing all kinds of adult coronary and non-coronary interventions in our center, and our focus has been on acute angioplasty, that is primary and rescue angioplasties, through which we could save a lot of lives in our center.
We do all complex trauma surgeries, joint replacement surgeries, which includes revision and re-revision. Fine surgeries, what we do is the discectomies, the trauma surgeries, the tumor surgeries, and the deformity corrections. We also do the limb lengthening surgeries.
We offer arrhythmia services, that is evaluation of patients with giddiness, palpitation and syncope, and these are all often due to cardiac arrhythmias, and we evaluate the cause of sudden cardiac death. And we also offer services like implantation of pacemaker, AICD, and CRT implantation for heart failure patients. And we also offer arrhythmia services for patients who have palpitations in the form of EP study and RF ablation.
The bulk of our work includes ligament reconstructions, meniscal surgeries, shoulder surgeries, and joint replacements of knee, hip, and shoulders. Our institution is equipped with state-of-art laminar flow theatre with HEPA filters, the most modern orthopedic equipments, and excellent post-operative care.
We are equipped with state-of-the-art amenities including spacious kitchen and canteen with most modern utilities capable to cater the nutritional requirements of our guests. Our infrastructure is designed according to World Health Organization standards and operations are backed up by a highly proficient team.
We also provide anesthesia for endoscopic procedures, arthroscopies and laparoscopies, and also labor analgesia for the parturian. We have an excellent surgical ICU where we provide post-op analgesia for our surgical patients. We have various infusion pumps and drugs which provide excellent pain relief.
We do have a psychiatric intensive care unit wherein we even admit patients along with the relatives. And we do have the consultation liaison facilities with all other departments, and we care the patients as a family member.
And we are routinely doing basic laparoscopic surgeries including lap hernia, laparoscopy appendectomy, laparoscopic cholecystectomy, etc.
We maintain 1:1 nurse-patient ratio as per NABH standards. We have a well-set infection control unit who take daily rounds in the ICU.
Major departments are cardiology, neurology, and general surgery, and all the departments. In cardiology department, we are regularly doing bypass surgery, off-pump bypass surgery, and along with other cardiothoracic surgical conditions.
We look after diseases of the brain, spinal cord, nerves, muscle, and neuromuscular junction. Our facilities here are, we have a very good neuro-intensive care unit with 6 beds. We have facilities for imaging with CT scan and MRI, and we have a good neurophysiological lab with nerve condition studies, electromyographic studies, and electroencephalographic studies.
Sun Hospital also has a dedicated intensive care unit for gastroenterology and hepatology with round-the-clock service and an audiology department with up-to-date equipment capable to handle hearing impairments of infants as well as adults. We are also having a fully functional radiology department with sophisticated equipments and facilities and the most modern 4D ultrasound scanning system.
എനിക്ക് 2002 ജനുവരി 30 ഹാർട്ട് അറ്റാക്ക് വരികയും തുടർന്ന് തൃശ്ശൂർ സൺ ഹാർട്ട് ഹോസ്പിറ്റലിൽ അഡ്മിറ്റ് ആവുകയും തുടർന്ന് അവിടെ തന്നെ ചികിത്സ ചെയ്യാനുള്ള ആൻജിയോഗ്രാം എടുത്ത് അതിൻ്റെ CD കൊണ്ട് ഞാൻ മറ്റ് 2 വലിയ ഹോസ്പിറ്റലുകളിൽ പോയി. പക്ഷെ അവിടെ എല്ലാം വലിയ ചാർജ് പറഞ്ഞു. അങ്ങനെ തിരിച്ചു വന്ന് തൃശ്ശൂർ സൺ ഹാർട്ട് ഹോസ്പിറ്റലിൽ തന്നെ ഓപ്പറേഷൻ നടത്തുകയും 14 വർഷം അതിൻ്റെ ഓപ്പറേഷൻ കഴിഞ്ഞിട്ട് ഇതുവരെ യാതൊരുവിധ കംപ്ലയിൻറ്റ്സ് എനിക്ക് വന്നിട്ടില്ല. പിന്നെ ഏറ്റവും കുറഞ്ഞ ചിലവിൽ ഏറ്റവും കൂടിയ സേവനം നൽകുന്നൊരു സ്ഥാപനമായിട്ടാണ് എൻ്റെ അഭിപ്രായത്തിൽ തൃശ്ശൂർ സൺ ഹാർട്ട് ഹോസ്പിറ്റൽ.
With a team committed to excellence, Sun Hospital is all set to cross new boundaries and take up new challenges. We are Sun Hospital and we connect with our guests in need of medical care and enliven them by spreading the light of life. Sun Medical and Research Center. Believe in life.